Opening an addiction treatment center in New Jersey. Miss a single required document, and you wait 6 months before you can resubmit to the state. New Jersey gives you 45 days to submit a missing document. Let those 45 days lapse, and you must wait another 6 months before resubmitting your application. How to open an addiction treatment center in New Jersey, the licensing authority, the functional review, the fees, and the application checklist. We cover who licenses you, the functional review, the 2-tier fee structure, and the documents the state expects. In New Jersey, every addiction treatment center, rehab, and recovery clinic must be licensed by the state before it opens. Licensing is mandatory. All addiction treatment centers, rehabs, and recovery clinics must get licensed before they open. There is no opening without a license. The program is operated by the Office of Licensing, or OOL, within the Department of Human Services Office of Program Integrity and Accountability. The application is short, but the attachment list is long, and a single missing document can cost you half a year. Miss a document and you have 45 days to submit it. Let those days elapse, and you wait another 6 months to resubmit. On top of the paperwork, NIMBYism is alive in New Jersey, where residents frequently resist new centers. Behave Health's all-in-one app is designed to put clinical, admissions, treatment plans, billing, and insurance authorizations at your fingertips. The platform brings clinical, administration, staff, admissions, treatment plans, billing, and insurance authorizations into one app. Behave Health can also direct you to resources for licensing or accreditation by Joint Commission or CARF. 4 steps take a New Jersey center from idea to licensed: the functional review, the fees, the application, and the deadline. Start with the functional review, plan for fees, assemble the application, and respect the deadline. Let us walk through all 4. Step 1. Attend a functional review with the Office of Licensing before you submit. OO offers monthly functional reviews where experts give technical assistance, walking through every requirement and licensing protocol. You can contact OOL at 609-292-6587 to learn more about functional reviews or register for the next session. Step 2. Budget for New Jersey's 2-tier fee structure, one for residential and one for outpatient. At publication, new residential providers paid a $500 application fee, a $500 inspection fee, and $3 per bed, with similar annual renewal. Outpatient providers paid a $1,750 application fee, plus a $300 inspection fee, then a flat $750 annual renewal. Step 3. Assemble the attachments. The application is short, but the list of documents is long. Expect a policies and procedures manual, a quality assurance plan, an infection control procedure, all clinical forms, and a client grievance procedure. You will also need a certificate of occupancy, fire and sanitary inspection certificates, an emergency disaster plan, and a bed bug policy, unusual among state programs. Step 4. Respect the deadline. A missing document has a hard clock on it. If you miss a document, you have 45 days to submit it to the Office of Licensing. If those 45 days elapse, you must wait another 6 months before resubmitting your application to OOL. Most centers will need to submit this core set of documents and items of note to the Office of Licensing. Operating entity information, an organizational chart, your tax ID, and level of care information establish who you are. Staffing qualification forms, copies of professional licenses in New Jersey, job descriptions, and a staff roster cover your team. A lease or deed, smoke detector, HVAC, and sprinkler inspection documentation, and a housekeeping contract cover the facility. New Jersey ranks 38th worst in the nation per capita for drug addiction and abuse, but recent signs are encouraging for new providers. As most states saw a sharp uptick in pandemic overdose deaths, New Jersey reported its rate stayed static, credited to existing public health efforts. Advocates introduced the Mainstreaming Addiction Treatment Act in 2021, which, if passed, would ease buprenorphine prescribing for opioid use disorder. Behave Health is committed to making it easier to operate evidence-based, results-focused addiction treatment centers. The all-in-one app is designed to put clinical, administration, staff, admissions, alumni, residents, and treatment plans in one place. Billing and insurance authorizations live in the same app, so a new center's operations run from one system. Behave Health can direct you to resources for licensing or accreditation by Joint Commission or CARF. Stop letting a missing document delay your New Jersey center. Book a 20-minute demo of the all-in-one platform at behavehealth.com. C. Clinical, admissions, billing, and insurance authorizations in one app built for treatment centers at behavehealth.com.